Hi, this is Tony with StuffSeniorsNeed.com, and I'm coming to you today with a video trying to explain the difference between Medicare and Medicaid. It sounds very similar, but they are actually two entirely separate programs. The programs are actually designed to cater to two separate and distinct types of people. So let's just begin. First of all, let me talk about Medicare. Now, Medicare is a federal program which is designed to provide health insurance to seniors. And it comes in a couple of different parts. Now, the first, Part A, that covers your hospital visits. Part B covers doctor's visits and durable medical equipment, which could be anything from an oxygen tank to a wheelchair. And then your prescription drug benefit, Part D, and that covers prescription drugs. Now, Part A you normally get for free. Okay, if you worked all your life and at 65 you get Part A for free. Part B you're going to be charged a premium. Right now it's $99.90 a month. That's as of 2/12, so maybe it changes a little. And also Part B covers 80% of the cost related to a doctor's visit or towards this durable medical equipment. The remaining 20% is either paid by you, out of your pocket, or through something that's known as a Medicare supplement policy, where a private insurance company will wind up making that additional 20% payment for you. Part D is your prescription drug benefit, like I said. These policies are typically reasonably priced in the area of $30 to $50 a month, and they have pretty affordable co-payments, and they definitely assist seniors in lowering their prescription drug costs. Now, Medicaid is a completely different animal, even though the names are similar. It's a program that's operated on both the state and federal level, and it is designed to provide a social safety net for the poor. Okay? Now, I'm gearing this more towards seniors, okay? So I'm going to explain the difference between community Medicaid and long-term care Medicaid. Community Medicaid pays for home health care services for low-income individuals. Now, I personally went through this process from my mom. She got community Medicaid, and that helped her for like doctor's visits where the doctor came to her, oxygen tanks, things of that nature. It wasn't that bad in terms of qualifying. It was just a 90-day look back on the finances, so it certainly wasn't terrible. Each state has its own requirements, okay, but one of the big differences is what's known as a spend down. Let me explain that to you. What a spend down is the difference between the amount of money you're making and what the state guidelines are for your maximum amount of money you can make to qualify for Medicaid. You would, in essence, have to pay that money out of pocket first before your Medicaid benefits were kicked in. It really didn't help my mother all that much, in all honesty. Her spend down was too much. We never got there. However, that changed when she had her heart attack. At that point in time, she really wasn't able to dress. She wasn't able to feed herself, things of that nature. And at that point in time, we had to look for a nursing home, in which case long-term care Medicaid applied. And that is a completely different animal. It is a 5-year look back on all financial records, and you can see the pile right there of paperwork from my mother. That is the result of 4 months worth of research, okay, into every single facet of my mother's life. And I certainly don't mind that. You have to remember something. I mean, for the nursing home, for Medicaid to pay it, they're paying about $400 a day. So Medicaid takes this look back seriously, the 5 years. Whatever you do, do not lie or misrepresent anything on the policy. It's fraud, it's a crime, and you could go to jail for it, besides having to pay the money back to Medicaid. Okay? So I just wanted to explain the difference between Medicare and Medicaid. I certainly hope this helps. This is Tony with Stuff Seniors Need, and I will see you next time. Take care.